Hi everybody, Dr. Alizadeh. Wanted to talk about the recent timely article that came out in the New York Post about the trends in natural breast procedures as well as an internal bra. The big difference between our approach and what has been described is that we do not rely on any mesh or cadaver skin or any of these matrices. We're actually using the breast's own tissue, and the thought process there is your breast tissue over time, whether it's through pregnancy or weight loss, has fallen because of the stretch of the skin as well as the breast parenchyma. So everything is sort of sitting on the lower portion of the breast. It's almost sort of fallen on the abdominal area. That, of course, causes its own issues with regards to neck pain, back pain, and not being able to fit into clothes appropriately. So what we do is essentially rotate the tissue up into the right position. So now the fullness is sitting on the top instead of the bottom. That's basically borrowing from Peter to give to Paul to give that projection. Then we go ahead and we use the bottom portion of the breast that it's usually discarded. So this portion is then used as an internal bra to hold the breast tissue up. And that is secured to the rib structures. So now you have a long-term position and stability of this breast tissue, of the weight of the breast tissue. And remember, this has been sort of rotated up and sort of held like this now. And if you still need to add more, I've been using fat grafting as a means of being able to provide better symmetry between the two sides of the breast. So now you have a very holistic approach, using your own breast tissue to give the best possible projection, and then using fat grafting to provide the best symmetry, and using your own internal bra technique, using your own breast tissue to be able to hold it up. Those three things, that triad is the most important thing you need to be aware of. If you do plan to go ahead with some of these other options with grafts or mesh procedures and things like that, be aware of the increased potential risks, especially the interplay between the implant and the mesh is important to understand. Happy to answer any other questions that may come up.